you, Cheryl. Good afternoon, everyone, and thank you for joining us here today. I stand here not only as the president of Planned Parenthood Federation of America and the Planned Parenthood Action Fund, but also a proud daughter of New Jersey, actually hailing from your district, Rev. Cheryl. Look, last month, congressional Republicans eagerly rubber-stamped President Trump's law defunding Planned Parenthood health centers, which could block more than 1.1 million patients who use Medicaid from getting their care at their local Planned Parenthood. Unlike those who traded away health care for millions, some lawmakers, including Rep. Frank Pallone and Rep. Mikey Sherrill here with us today, fought hard. They fought hard and tirelessly against this measure until the bitter end. We are so grateful for this support, and we also know that this fight is not over. The consequences are devastating for Planned Parenthood Health Center patients and everyone who will need care one day. That's why Planned Parenthood Federation of America, on behalf of all of its member organizations, immediately took the Trump administration to court. Okay? While many are capitulating to this administration, Planned Parenthood Federation of America stood up to fight this clear attempt to attack and punish Planned Parenthood for proudly providing and fighting to protect abortion care. Last week, PPFA won a critical victory against the Trump administration when the District Court of Massachusetts blocked the defund provision from being enforced while this court battle continues. That means that patients can use their Medicaid health insurance to get care at Planned Parenthood health centers right now. And that's what it's all about, making sure patients everywhere can get the high-quality care they rely on no matter what. Make no mistake, there is still a long road ahead of us, but this is a fight that we cannot back down from. Defunding Planned Parenthood will do incalculable harm to Planned Parenthood health center patients and the public health infrastructure. If allowed to go into effect as intended, as many as 200 Planned Parenthood health centers in 24 states could be at risk of closure. A majority, 60% of those health centers at risk of closure, are located in rural areas or places where there aren't already not enough primary health care providers. That means in places where there are few, if any, other options of care, patients could lose access to everything: STI testing, birth control, cancer screenings, abortion care. President Trump and the congressional Republicans who voted for this own this crisis. Because of them, cancer screenings, cancers will go undetected. STIs will go untreated. Patients won't be able to get the care they need to plan their families and their futures. Because of the unreliability of our healthcare system, already strained under the weight of COVID, the abortion access crisis caused by Dobbs, and just the general challenges of delivering healthcare in communities in these times, this added strain of defund is going to force some Planned Parenthood health centers to make shifts, some to reduce services, some to close, and other providers are simply not going to be able to make up the difference. This is not a big, beautiful law. This is a big betrayal of the American people. Patients are going to have to travel further to get their care. They will have to wait longer as demand increases. This is harm that is on their hands. The Planned Parenthood Action Fund is going to continue to fight, and we're going to continue to call out all of the lawmakers who have voted for this bill, and we will ensure that they are eating their votes every single day on the behalf of our patients. And now I'd like to introduce Dr. Elizabeth Talmont, who is a provider here, Planned Parenthood of Northern, Central, and Southern New Jersey, to give some remarks.